We're all going to be talking about Beyond the Score, rethinking what we know about cardiovascular risk assessment. So, right at the beginning, I always like to ask our guests to tell us a little bit about their personal journeys. I find it's really interesting and we can kind of learn a little bit more about y'all. So, I'd love if you could tell us how you arrived at your careers today and how you really found your interests in cardiology and specifically in understanding risk assessment.
Really interesting to think back to being a medical student. And I remember very vividly a patient I saw around the holidays who was admitted with heart failure. And it was probably her 10th admission that year, was repeatedly in the hospital. And I remember thinking, we seem to keep tuning her up and she keeps coming back. Is there something we can do for prevention? Fast forward a couple of years, and I was in fellowship, and I had the opportunity to meet Don Lloyd Jones and talk about how we think about prevention of cardiovascular disease, and started to ask, why don't we think about prevention of heart failure the same way? And that has all come together now with training in preventive cardiology, epidemiology, to think about cardiovascular disease risk assessment holistically in the work that I do as a physician scientist on the spectrum of cardiovascular risk assessment and prevention of heart failure.
Thank you. Dr. Ndumele?
Yeah, I'll go back just a touch further to high school. So I got
It's a lot
dragged by my
longer ago,
mom.
too.
It's a little bit longer, just a little bit longer. Yeah, you don't have to say a lot, a little bit. I got dragged by my mom to a community health program that was doing local screenings in our community, and it was a diverse population. And I was initially dragged in, but by the end, I was really hooked. We did a lot of health screenings. We were discovering a lot of unaddressed risk. And there was a lot of receptiveness to people learning about their health status and having motivation to understand ways they could kind of improve their health. And the idea that we could make that difference really got me even before I started kind of more formal training. And, by the time I got into medical school, it was clear that cardiology was a special place for me. And then cardiovascular prevention just really harkened back to those initial roots of thinking about communities and understanding that there were a lot of this cardiovascular disease that we're seeing had predictable origins that we're often not addressing, and particularly communities like the one that I started doing work in were some that were not being addressed by a lot of our traditional preventive approaches. So a real desire to make sure that we were providing care and preventive care for people across the spectrum from all backgrounds, and it kind of led to being able to hang out with you all here today. So, and I think excited for where this journey has taken us to thinking about how we can prevent some of these bad things from happening.